KX News at 6 starts now.
Good evening, I'm Lauren Culver.
And I'm Chad Mira. Thanks for joining us tonight at 6. And our top story tonight, addiction treatment in rural areas. Addiction is not unique to North Dakota. It's an issue that spans the country, but treatment is scarce in rural communities, which make up most of the state. Renee Cooper visited a rural health care center that is one of a kind in its efforts in responding to the vast need for addiction treatment.
Substance use is pervasive in family physicians' practices. We see this every day. And so in order to try and fill that gap, we felt that it was important to try and offer the services here in our hometown.
Rural parts of North Dakota have been hit hard by the opioid epidemic. Beulah's Coal Country Community Health Center added addiction treatment services in 2009, and these services are unique to rural areas.
The closest substance use services that we have had prior to this is in Bismarck or Minot or Dickinson.
The center offers rural North Dakota's first drug and addiction counseling, as well as medication-assisted treatment.
It's not something that you have to be embarrassed about, that it's a disease, and fight the stigma that leaves people feeling like they have to do this by themselves.
Dr. Garman is certified to administer Suboxone.
Minimizing your withdrawal so people can regain a functional life without having the devastating effects of the withdrawal.
Dr. Garman says the drug is made up of two major ingredients. One fills the cravings for opioids without the euphoric high that comes from opioids. The other blocks the effects of opioids, which protects against the misuse of Suboxone.
A perfect story that I can tell you about a young gentleman who I was taking care of with opioid addiction. I asked him what his life would be like if he wasn't on Suboxone. And he said, I'm married, I have kids, I would be in an alley shooting up my drugs right now and not know my family. But now I go home every night after work, I have an apartment, I have a good family life, I take care of my kids and play with my kids. That's the difference between what our program provides and not being in the program.
Renee Cooper, KX News.
Dr. Garman says methamphetamines and prescribed opioids are the drugs he sees people struggle with the most in rural North Dakota.
And Coal Country Community Health has also been working alongside schools in Beulah to prevent substance abuse and addiction before it develops. The counselor at the high school says they started a conversation with the health care center a couple of years ago. They began a partnership to create a behavioral health program to help students facing financial barriers. The high school is now equipped with a visiting psychologist, clinical counselor, and a full-time social worker.
The more we get in the classroom, the more conversations that we're having with students and increasing their awareness about their own emotional and behavioral health wellness. Where am I at on that continuum? Am I healthy? And if I'm not, who can I go to for some of those supportive resources that we have here in our community?
Together, the new additions make up Beulah High School's Impact Team. They have a screening tool which helps determine which students are in need.
As we mentioned, finding treatment can sometimes be tough due to a lack of services. According to a 2016 Department of Health report, in North Dakota, there are only 25 facilities or programs that provide mental health services. There are 52 primary hospitals overall, but 19 North Dakota counties do not even have one. And 12 of those are in western North Dakota. Almost 40% of North Dakota's population lives in rural areas. That's about 269,000 people, according to the 2010 census.
A mother who